that make sense? I'm gonna blow my nose. I'll be right back.
It's working, but the camera needs to be set up.
Okay, Chaz can do that. The audio's working?
Yeah, but they were doing a test and testing.
Let me blow my nose. Right. What is this she's watching?
Miss Rachel.
How?
She only watches it when she's sick.
Oh, okay.
I think we're good.
Okay.
Mom. Oh, it's fun.
Where's the camera showing the top of that chair?
There's a delay. You guys are probably just in a lag.
Like 5 minutes, 10 minutes away?
No.
Because it's fun.
All right, Chaz, dial us in there.
I know it's because I feel the new strengths, and I get up right this morning. That's how you I need to pull back out. I need to sit backboard and go. Because the ergo makes it more. Yeah. Yeah. But my neck.
Are you using the ergos right now?
I have them and I can't.
You can't get used to them. You got to just commit for like 2 weeks. It only takes 2 weeks and you'll be good to go.
I got them two years ago.
Oh, did you really?
The ergo, a really expensive cabinet decoration.
It has been such a game changer for me.
Yeah. Oh my God.
It really has.
Just how you feel.
Yes, 100%. I just feel tons better. Me? Maybe 2 years. Yeah, 2. Okay. It definitely takes a minute to get used to them. Hey, Kevin, will you go see if my assistant is out there? I saw her walking that way. I don't know where she's going. Is there some audio out there? Okay, good. All right, guys, so I'm going to leave this light just off because it kind of messes up our video. So I just kind of want to look really closely at these teeth. So this is the point where Rob Soto will go and air braid all these teeth just to make sure there's no temporary material anywhere. That, if you want to do that, that's not a terrible move. Really, the only downside to that is if you're putting temporary veneers back on, you have now micro-wetched all of these teeth, and your temporary veneers are just going to be really, really, really locked on. So just for that, I like to not use it. But I am going to go, just like you guys all just saw, I'm going to go and check all of these surfaces and just try to make sure I don't have anything holding me up. Okay, so we're going to try these veneers on. I like to use glycerin, and I'll just put it right on top of the teeth. Let's go, Karen.
Is that just for like getting them to stay on?
Yeah, there's just like something holding them on. You know what I mean? These are probably a good like I'd say 7 millimeters or 0.7 of a millimeter. If these were thin, like close to 0.5, I'm probably just going to do a water try-in. But when you use a good lab and you're thorough about cleaning up your temporary veneer material, everything should just kind of go in nice. But as I'm putting these in, I'm just kind of watching. Just
Sorry.
No, go ahead. It's
Do
great.
you feel like a full stop when you see them because there's a little incisal lip
Yeah.
there?
Yeah, I do.
Like it's not gonna go.
Yeah.
across.
There's definitely a positive seat. So right here, I'm feeling like a little bit of bounce with that tissue. So I'll probably pack a piece of cord on number 4 right there. So then we'll try on number 11.
Those look dang good.
Yeah.
Wow.
And this is literally how they should fit when you use a great lab. They just should pop right in. If you guys want to make good content, you have to learn to seat the left side of the mouth with your left hand. You guys comfortable with that? Who can do that?
No.
Ben's like, I got that.
You're asking too much.
These are the paint brushes I was telling you guys about. Yeah. So I'll go in and just kind of clean up. I'm going to clean up my cement just like this with this same brush. So right now, I'm just kind of thinking about, I shouldn't have to worry too much about shape. These should be the same shape as my temporaries, but I'm thinking about color. Like, how am I feeling about the color of all those? I like it. I like it a lot. If anybody's like looking really close, I almost wonder if I want a little bit more brightness in my front 4. Maybe my front 6. Here's what's that? These are Lissy. They look crazy white in that picture. I think that I asked for 2.5, OM 2.5 on these. I'll have to go check my lab slip, but I'm pretty sure that's what I asked for. These are, I feel like I would like these to be just a tiny bit brighter. So what I might do is I might try in some light. So grab that light. And I might put it under just for 8, put it back down and see what I think. I'm just going to do like a test on one tooth. So I'll put that on with just a little bit of lighter cement. I'm going to clean it up again. I'm just going to see if I like that better than I did before. So again, like I'm trying not to be, I don't want to be in a hurry. I just want to be deliberate. Does that make sense? I just want to go step to step to step. So do I like that more? I probably do. Can you guys, everybody come get close and just kind of take a look. That number 8 is just a little bit more vibrant, yeah. I like that. So that's probably what I want to let her see for her first time seeing these veneers, is that color instead of this color, I think. So let's put the front 6 on with that. This is actually an interesting thing about veneers that you guys may or may not have ever considered, but when you're looking straight on at a set of thin veneers, when you're looking at 8 and 9, your eyes are only looking through like 0.5 millimeter of porcelain. But when you look at those premolars, your eyes are actually looking through like 8 millimeters of porcelain. It's literally 16 times as much porcelain. I don't know if you guys ever thought about that before, but a lot of times your labs will actually use different ingots for the premolars, and sometimes even the canines, just because you're looking through such a thick piece of material. Does that make sense? They'll use a warmer ingot. Yep, exactly. Okay, so let's throw, Cameron, just throw a little bit more light on all these.
Are you doing that over the glycerin that you used earlier?
Yeah, we're just mixing it with it in there. That's fine.
It's the same color.
Mm-hmm. Did I skip, man?
Yeah.
Testing you guys. You guys passed. You guys passed the test.
Good left-handed skills.
I had to learn that because my assistant was always, when she'd record video, she's always like, I can't say anything after eating your hands in the way. She's like, you got to use your other hand. And I was like, are you kidding? Do you know what you're asking me right now? I like that. I like that a little bit better. I think I want 12 to be a little bit brighter too. So let's throw a little bit underneath 12. Hang on, let's dab that blood just a little bit. At this point in the process too, if you've got like one little spot that you're trying these on, you can't get it to stop bleeding, probably superoxyl is your friend right now. You don't want to be really messing around with viscostat at this point. So I like that. I like the way that looks with just a little bit lighter cement underneath them. Mm-hmm.
What shade cement do you have right now in the room?
I have Panavia's white, which I'll never use. I have Panavia clear, which is probably my most common cement. I have soft white, which is brand new. This is literally like a month or two old. This is brand new. Probably my absolute favorite cement. And then we've got some warmer Panavias. It's like a brown. That's another clear. And then I have a warm Verilink, and I have a light Verilink. And usually I like to have the light plus as well.
That's what you said.
I like to have the light and the light plus. So I like to have all the cements available to me. So here's what I want to do. I want to let her take a look and make sure she likes them. And then if she loves them, I'll let all of you guys sit down and kind of take a little look. Okay. Hi, Miss Carrie. I'm about to let you take a look at these veneers. They're just sitting on your teeth.
Okay.
There's nothing holding them in place, so just be super careful with
Okay.
them. But I want you to take a look at the color, make sure you like the color, and then kind of the overall shape as well. Like, I want you to just kind of make sure you approve of both those things. The shapes should be very, very close to what your temporaries were, just kind of a little crisper, sharper version of that. And then the color, we'll see what you think of that as well. And then I also like to put some glycerin on her lip for this, especially if they have like really dry lips. They're about to see their porcelain veneers for the first time in their mouth. So you just want the presentation to be like as nice as possible. Okay, girl, let's have you take a look. We'll pull these sunglasses up for you. What do you think? Do you like those?
Yeah.
Do you like the color?
Yeah.
Okay.
Love it.
Okay, awesome.
Yeah, don't you?
I really do.
Yeah.
I for sure do.
Yeah.
I actually put a little bit of lighter Trian paste underneath them
Yeah.
to brighten them up just a tiny bit.
Yeah.
They weren't quite as bright as I wanted them to be, so I brightened them up a little bit.
Okay.
Where they're
Yeah, I
at
like
right
them
now, I
brighter.
really like.
Yeah. I like them.
Do you like the shape?
Brighter. Yeah. Love it.
Okay.
25 out of 25.
It looks like you were born with that.
Yeah. Yeah. It's really natural.
Okay, should we put those in?
Yeah.
Okay, awesome. I'm gonna let everybody come take a look real quick,
Okay.
and then we'll take them off and get them in for
Okay.
you. Sound good?
Yeah.
Awesome. Okay, all right, let me back up a little bit. We're just gonna let you, whoever wants to, come have a seat, take a look. Let me get these gloves back out. These are large. Cameron, you wanna get out some, what are those? Okay, we've got some large and smalls here. So you guys feel free to sit down and take a look. You guys take a look. I'm gonna eat some key lime pie. Did you guys try that?
It's so good. Yeah.
How we doing, girls? Did everything go smooth today?
Yeah, it went great.
Okay.
We're putting one on one side,
Hey.
one on the other, so you just grab your.
Oh,
pad and
awesome.
go.
Perfect.
Okay?
Hummus, and I wanted to like.
I forgot to promise.
So do you want me to just be like, hey, let's do this, because you like so fast.
I do go so fast.
How do I tell you?
I would just say, are you ready to pumice? That's all I'd say. Yeah, that's all good though. It's not that big of a deal. This is old news to you. You've seen this. Exactly this.
Really good.
You look pretty, huh? I'm putting them in. I don't think I saw how fast I was going, but I almost can't screw it up. Like the fit is good, just like boop, 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 boop. Nothing makes the appointment go smoother than a good. But what I should say is nothing makes the appointment more in-ears that don't quite fit.
I think it's right.
Yeah, it's right there. I'm just listening in on you. Like, take the hairs out. Yeah.
This is hearing itself out here.
Are you doing
Is there?
It's hearing itself out there, so it screeched really loud.
How is it?
Because it's hearing it on the TV.
Oh, okay. Set this down somewhere where it's not.
What's up? I said, what's up, buddy? Thank you very much. So sweet. Boy, no, me too. Like, I know. When they came off, I was like, oh, damn. I almost want them to be a little tougher. Well, when there's a point where they're too smooth, you guys learn less.
Sure, I agree.
When like I have to like troubleshoot a little bit, you guys just learn.
Well, last week you just rushed to clean up your filter.
Yeah.
Like I saw, there's a tip, so you can see what you're doing. So that, you know, like, easily.
Right.
Yeah. So,
It's this last one, though, right?
Are they real? Are they
Yeah.
Because it's like making raving noises.
Yo, right.
Maybe after I fix it, but it was just. Yeah.
Let me upload those.
Like you private because you can definitely it's different. Like people
Hey. Michael, you know we didn't talk much about. We started asking people what their WTF. We got one answer, and then we got super excited. Hold it. Talk about. Ready? Okay, sweet. Let's do it. All right. Last call. Anybody want to take a look that didn't already? Okay. I will tell you, just to get a good fit is worth paying whatever it is extra just to get that good fit. Like, I don't know if you guys noticed, but when I was trying those in, it was like bloop, 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 bloop. And it really should go like that.
So Dark Soda uses Frontier for half his cases, and he's like, whenever I use Frontier, it's like I put one on and everything moves, but he's like, anytime I use a V-Smile, it just seats. Like that's what he told me. It's like it just seats.
It's always different, man. I used Frontier for years. Right. And sometimes the veneer would be on, you know, it's seated, but there's like a black line behind the veneer. Like the fit is just not quite there. And I think that not that Frontier is a bad lab, but they're putting out thousands and thousands of cases. Do you know what I mean? So I think it's impossible for them to QC to the level that you saw V-Smile's operation. Like Keok is overseeing every single case that leaves that lab. You know what I mean? It is amazing. All right. So, she loves them. I love them. I love the fit. So I'm going to take a snapshot. I definitely have a little bit of fullness up here in the premolar area that helps it match the flow of my canines. My laterals are just a little bit shorter, which I love. My lengths of my premolars are really, really similar to the lengths of my canines. This crown, I actually won't have Karen clean this crown because I'm going to try it in again after I have the veneers in, just to make sure it still goes down properly.
Do you know there's the crown also Lisi? Or is the crown?
It's all Lisi, yep. Okay, so when you guys can you hold that veneer me over when you guys get this, take a gray Sharpie and write numbers on this all the way around, and buy 2 of these so you can write lower numbers on this. So you always know where you're at with you want to take a picture of that, Drew? Okay, so I just took off number 4. I'm gonna put it right there.
You can't see the little tiny numbers in the middle.
Yeah,
Like
you can't.
At least mine has like.
Yeah, it's like 2211. Yeah. So we have the sticky pad in there right now because these veneers aren't like, they're thin. I can measure one for you guys if you want, but they're not like crazy thin. You know what I mean? These are all 0.5, 0.6, 0.7. There's nothing under 0.5 here.
So if they were thinner, you wouldn't use.
I wouldn't use that little sticky pad because I don't want to like peel it off of it. You know what I mean? So I actually take them off a lot slower than I put them on. I don't know if you guys noticed that or not, but I'm more worried about like dropping something or messing something up when I'm taking off.
I notice on that, the veneer means you like, if you get that top wet with water, like it loses the stick really fast, right?
Yeah.
Just try to keep it dry until you start rinsing.
Yep. So I really feel good about my tissue like 6 through 11. I'm a little nervous about it like 4, 5, and 6. And then 12 and 13, just a little bit. Huh?
You want me to show them again on the camera?
No, I think they're good. Are you able to watch? You can video that if you want. Okay. Oh, do you? What do you guys think? This is your case, Monday morning. How are you going to manage how are you going to condition the tissue? You guys just going to do a round of Visco Clear? Are you guys going to put cord anywhere? Or are you just going to do Viscosteer? That one that bounced a little bit, so that was number 4. Anything else? What are you guys thinking? Let me, Carrie, turn that way just a little bit for me. I'm not like way concerned about this tissue right here, but it's just a little red. I think Viscostat Clear would probably just do what I need it to do there. So maybe we'll just put one piece of cord right there on 4 and call it good. Or if you were like really concerned, you could put a piece from like the beginning of 6 over to 4, because that's a little bit red, but I think Viscostat Clear would take care of that. I probably want to be, I'm a little more careful with like really thin biotype, which she has. Can you see how thin the gingival biotype is there? Like 8, 7, 6. I'm a little more cautious with that type of tissue. I'm gonna just think twice about packing cord and tissue like that. So in her case, I'm probably just gonna put some just on tooth number 4 there. So, but because I'm using Viscostat, here, let's go straight back up again. I'm just gonna kind of put it everywhere. I'm gonna be a little careful right here because I definitely have some dentin. Is that sensitive? Okay, she felt that, so we need to numb her up just a little bit more.
Country, your music of choice here. This is your peaceful.
We've been doing a lot of house music lately. That's kind of been our jam lately. Rufus Del Sol, is that a band? Yeah, we've been doing a lot of Rufus Del Sol. If we do country, I want to do like Jelly Roll. I don't want anything too twangy. What do you guys listen to? What gives you guys superpowers when you're delivering a case? Tupac? I like that. Tupac's your superpower? What's that?
Oh, Dave Matthews.
Dave Matthews? Oh, that's a good choice.
That's your 000.
Yes.
Or,
Yep.
right?
So I packed that right over the top of Viscostat Clear. And once we get like ready to go, that tissue should not be an issue at all. If you've got good tissue and you want to like just not worry about it whatsoever, by good tissue, I mean like a nice thick biotype, you can just pack one piece of cord all the way around. It takes you a minute or 2 to do it, but you could pack one piece of tissue or cord all the way around, and it's gonna do awesome. It's gonna do great. I think Soda does that on every single case, Ben. Is that right?
Yeah. Prep said to do it, or up to prep. No. That's where it's fine.
Yeah. I was like,
Yeah, at first, for sure. Because they're making sure. Hygiene check.
Right? It's 10:45. You have 3 hygiene checks, and yesterday's root canal is in pain, and they're here. So this is good. You guys can see Karen's just finishing up. It should take her about the same amount of time as it does you to kind of take care of the tissue. So she conditioned the veneers, I conditioned the tissue, and now we're like ready to work together on the teeth. Carrie, was that sensitive? No? A little bit? Where at? On the right side?
Yeah.
Okay, we'll numb that up a little bit more. We still have to do that a few more times.
when you do the Seattle squeeze, will you go back and give extra in the anterior when she's numb, or the Seattle squeeze is enough?
You know, when I do the Seattle squeeze, the one place I like to go back and add some is to the canines, just because when you're doing that Seattle squeeze, it's a little bit superficial, and the canines, those roots are so tall. So I'll go add and just add deep at the canines. That's usually the only place I supplement at.
When you have like a true like no prep and like the veneers are super thin, when your assistant's cleaning them, like are you guys going like extra careful with the scrubbing, with like the hourglass clean? Or
If they're really thin, then yeah, we're a little more careful. But honestly, what you're seeing right now is literally like most of our cases. Most of our cases are this sort of near no prep that you guys are seeing, and veneers about that thick, like 0.7 to somewhere between 0.7 and 0.9 in thickness. This is honestly a pretty routine case for us.
So you have cord on the right, not the left,
Yeah. I could probably use some right here on number 12. It wouldn't hurt a bit for sure. I have one piece of cord right there on number 4.
Why you mentioned you've been doing more cord, like what? Just felt like there's more control or?
A little more control for sure. And definitely less irritation from the air abrasion. I love that if there's a few particles that are sneaking backwards on me, that they're just bumping into cord and not hitting some freshly irritated piece of tissue, you know? Yep. Yep. Hey, what is the next really, really important step? Maybe before air abrasion, what do we need to make sure we do right now after having just controlled the heme? Got to get that off. Got to get that viscostat clear off, or it's going to stain underneath these veneers. Yep. So we're just going to take some pellets. Go ahead and, oh, you got some ready to go. Karen's already ready to go.
Good job, Karen.
Right? So you're just going to take this and just kind of like scrub that area where the viscostat was hanging out.
Sorry, this is water or is this?
This is hydrogen peroxide.
Hydrogen peroxide.
Yeah.
Ah, okay. Not super awesome.
Yep. And I'm probably going to do it twice just to be thorough.
So if you, in this stage, if you knew you're not going to do tense because you liked how everything looked and you're going to seed it, will you prep start now?
Say it again. If I knew
You
what?
know you're not going to put temps on. You're obviously going to seed it today. Will you prep start now?
Yeah. Yeah, I will do that in just a minute. Yep. I am a huge fan of air abrasion for a couple reasons. One, it cleans everything. So if I missed, and did you guys notice I didn't pumice before I tried these on? I didn't pumice, I forgot to. If I miss something with my pumice, as far as like biofilm goes, that air abrasion is taking it off. If I miss something with temporary material, the air abrasion is taking it off. I'm a huge fan, and I'll tell on myself. I have a set of veneers running around. It's my hygienist, so I keep a very close eye on it, that I literally forgot to etch the teeth. Don't ask me how you forget that step, but I forgot to etch the teeth.
For just?
Yeah. But they're air abraded, and they are doing great, right? That kind of like testifies how powerful that the micro etch from the air abrasion is. You know what I mean? Like
your most annoying hygienist, right?
No, she's awesome. This guy trying to set me up. No, she really is. She's awesome.
It's not enough to get etched.
Yeah, not enough to get etched, but she's a good employee. Not like micro etch and bond. Okay, cool. Let's do one more real quick scrub, Karam, and then we're gonna throw an Obfuscate in there. Who said they have trouble with Obfuscate staying in? Everybody does? Okay. I don't like to do any superoxyl until I have my Obfuscate in, just because I want to like protect that mucosa so strongly. So this is the trick. You bend it really tight, right in the middle, get one side in, get the other side in, and then I'm gonna pull her upper lip up, let it get way underneath there, pull her bottom lip up, let it get way underneath there, and you should be good to go. Okay, so now, Karam, let's just dab some superoxyl and see where it wants to bubble up. So I definitely know I want to like just kind of dab it around this number 4. I'm feeling pretty good about this heme control. Like, not a whole lot of bubbling. You can see. Can you guys see where it bubbled a little bit around 4? Blanch that tissue just a little bit. That was superoxyl. I did, just to kind of like test and see what would bubble up. And then I don't leave it on real long. I rinse it back off. You can see a couple spots went white around like 12 and 13. Maybe a little tiny spot on 10. Definitely a little bit around 6 right here, and then 4 and 5 as well for sure. Okay, cool. I'm feeling pretty good about this. I think I want to get on to the next step. So let's go ahead and air abrade these. So this angle right here is so important. You want to angle that away from the tissue. And those of you who are like close to me, I don't know if you can see this on the TV screen or not, but that tooth is like super matte. Sometimes I can cast the right shadow on there and you can see it. So that tooth is like super matte now. And so far, I haven't caused any bleeding, but that papilla right there is definitely making me nervous. I'll definitely hit that papilla with a little more superoxyl before I'm done. What's the difference? This tip is like way smaller. Yeah. And it's nice to just have this little tiny wand. So I've got more control. And the wand just feels better in your hand than that whole piece that comes from Danville, the micro etcher. So it is nicer. Do any of you guys have this Prep Start? You have the Prep Start?
Yeah.
Oh yeah.
I use the one in ortho.
Okay.
He's like, sorry, this is like yesterday now, and he's
So the only downside of air abrasion is just that it's messy. There's literally like sand everywhere. You can see there's like a sand on my patient. So I do like having an air at your like veneer operatory that's just air. Yeah. Yeah. You don't have to worry about any little like spittles coming out as you're drying those teeth. Okay. So we're air abraded. Karen, let's see. I want to see one more of these. I'm like, my brain is like never very far from bleeding gums. Bleeding gums are always like at the edge of my brain. Like I'm thinking about it all the time. So I'm just going to retouch up some of these spots. For some reason, that one right there at the corner of 7 and 8 is like making me nervous. Yep. So we're just touching it up again with some superoxyl. See how white that went this time? I must have like irritated that gum just now with my air abrasion. Like I'm legit considering putting like a little tiny piece of cord like right there and there. Yeah, but we're not going to. Okay. All right, so we haven't crossed that like threshold where we have to stop using superoxyl yet, but we're close, right? So we're just kind of keeping an eye on everything. All right, Karen, let's go ahead and etch.
You already asked.
Okay, so I recommend having your assistant help you out with this. Like, you guys start at the midline. Oh, these are huge tips. Holy smokes.
Mm-hmm. Karen does it way better.
She's so much better at this than me. So you need to be just beyond the incisal edge, depending on how your veneers fit. Carrie, open a tiny bit more for me. So let me kind of get my mirror in here so you guys can see it. So if your assistant's going to miss something, it's going to be the distal of a premolar or the distal of a canine, which Cameron didn't miss anything because she's done this a lot of times, but that's where your assistant's going to miss. And then just make sure you're around the edge really well, and you guys should be good to go. So. All right, so we're about to cross that threshold. Who wants to touch everything with superoxyl one more time? Who wants to put bond on? Should we take a vote? What do you guys want to do? This is a choose your adventure veneer seat. I'm going to touch them up, I think. I mean, I've got nothing to lose, really, you know? I'm not going to mess up those etched teeth for sure. Especially 7 and 8, man. 7 and 8 just makes me angry. What were you saying, 11?
I mean, it's just the TV.
You're not going to mess up your etch surface here. This is just like high concentration of hydrogen peroxide. However, you do want to get it all off. Like you could, if you were to leave some of that on there, you're definitely messing up the chemistry with your bond. So you do want to get it off. Okay. Feeling pretty good about it. Okay, so we've got that. Can you see the frostiness on that TV? I don't know if you can see it or not. Got really nice frosty looking teeth that are just like begging for bond, right? Okay, so there's nothing pretty about getting bond on these teeth. Just get bond on them. I use a big brush and we just get it on there. I do like to scrub it in just a little bit. And I'll go back and make sure I've got it on the linguals as well. Got to have bond on the linguals. What are you guys saying? Did I go too fast getting that on? You want me to slow down? And put the bond on slower? There's no reason to be delicate about getting that bond on. Just get it on there.
Don't cure it.
Yeah, don't cure it. Yep. So I just want to make sure I have good bond on my linguals, on the insides of the ledge, and maybe just beyond the lingual.
James, have you used Panavia's tooth primer? That blue bottle. Have you seen that?
I haven't. What's that for?
And like, I don't know, in our practice, that's just kind of the protocol to use that. So I was just curious if you knew the difference or maybe that's it. Yeah.
Oh.
It's really good when you're already like,
Or maybe like you only have to use it if it's like certain.
If you do zirconia, that's what you're saying.
You said you put yours in the restoration?
Yeah.
So you just like cut it to just like regular.
What-
thing, or something like messy, or what's the reason for that?
I don't know, honestly. It's just the way I've always done it.
I go back and forth from each year that you have a
Yeah.
reason, a good reason or bad reason.
What do you guys do? Do you guys like cement in the veneer or on the tooth?
Yeah, that's me.
You like in the veneer? What do you do? In the veneer, okay. Yep. No, I want to use this guy. You have cement in there already?
Yeah, you said the light.
Yeah, but I want this. What's that?
Oh, I was in here, but I was missing too much of the discussion.
Oh, is my audio coming out there?
Yeah,
But it's kind of
you
late.
perfectly.
Okay. Oh, I see. Yeah.
Yeah. I was debating whether I wanted to hear this comment, but I thought someone else might talk.
So this is literally the worst possible time for something to start bleeding. And if it does, like, there's no exact way to manage it. It's just like, you almost have to make a judgment call of how much is that bleeding? Like, can I put some pressure on that? Get that stopped really quickly? Can I manage it? Oh man, I'm probably gonna put some pressure on it with like a cotton roll for a second and see if it stops. If it doesn't, I might see 9 veneers instead of 10. Yep. Okay, so we're gonna put 8 on, and that should just fall right into place.
Wow.
And then I'm just gonna kind of clean up as we go with this little Amazon paintbrush. So And if you guys wanted to just like touch that, maybe just touch that, but be so careful with that.
There they had the question about blocking out 13 during this echelon process, since you're not seeing that now. You're not worried about it.
I'm not super worried about it. Yeah. If it was like if for some reason I wasn't putting a veneer on like a no prep tooth, that'd be different for me, but so watch how like gentle I'm going to be here. Did the veneer move? I don't think it moved. If you're going to touch any lingual cement, do it like so carefully and only with a brush.
Are you brushing gingerly to incisively, or it doesn't matter?
I don't know, Chris. I'm just kind of like whatever. Yeah. So see how there's like a lot of cement around the insides of the ledge at number 6 there. I am going to take that off because I need to be able to see these veneers. Does that make sense? I need to be able to see them to make sure they're seated the way I want them to be seated. So I definitely do. And when you're brushing that off, usually you're kind of going mesial to distal, so you're a little less likely to kind of dislodge something. I do have a bigger one that I'll use when there's like gross stuff to clean up, but typically I'm just using that smaller one. Okay, what do you guys think? Can we see like actual veneers left-handed? Should we work on that? And see how like right now I can't see like the profile of number 11 very well with that cement, so I am going to take that off. This consistency of this Panavia is like so great. I like it so much better than the current VariLink. I used to like VariLink more. They changed it like
It's okay when you go through.
like a year ago. I hate that they changed it.
It is
Yep.
an easier cleanup than it used to be.
Does it clean up easier?
Well, I kind of gave up on pre-cleaning it, and I just get them in a cure and have the big chunks and it
Just pop them out. Okay. Does that work good in your hands? Just having like bigger chunks instead of smaller chunks?
Better in my hands than the other method did.
Okay.
But not, it's a lot of bleeding when you clean up that way.
Yeah. So
I did that after Ed showed that that's how he did it. In the 2020 I receipt video. It's been many years for video.
So this is where I want to recall that snapshot I took of these veneers. And this is where some of you might want to like actually like stand up and look at these veneers. You know what I like to do is I like to wear black gloves, and I like to put a little bit, it looks different in that than it does to my eyes, but I like to get some black behind the incisal ledge of those teeth because I know what those lateral incisors look like. I know what the premolars and canines should look like. And so I like to get a little bit of a black backdrop for those teeth so I can just see it a little bit better, especially when I have this white 2x2 in there. So it just kind of helps me see everything. But I like where we're at. So I've kind of, I don't know if you guys saw this, but I kind of took the end of a cotton roll and I went through and just kind of wiped the front of these teeth off. That's just because I'm about to spot cure. That makes you nervous?
Yes.
Does it? You got to be gentle. Are you nervous about dislodging something? Getting a black bubble underneath your veneer? I just don't want to have any cement on the front of those teeth when I tack cure. So I like where we're at. Everything looks just like it did when I took that snapshot in my brain 30 minutes ago, whatever. So we're just going to start with 8 and 9. I'm just going to kind of hold this in place. It shouldn't really move. And then that tack here is like right up against my glove, and we're gonna tack it right in the middle for like a 1-2 count. So 1, 2. Can you guys see how I'm pushing it like against my thumb? So my index finger is holding the veneer in place. At this point, they should be fully seated though. So I shouldn't have to really shouldn't be moving when I do this. And my thumb is kind of holding that light in place. And then we don't have one on 13 over there, so we'll just come cure 12. Okay, good. So
Did you do 11?
Did you do 11?
did I skip 11? Let's do it again. Just make sure.
You didn't skip etching, don't worry.
Did I get it matched?
Forgot silent.
So I kind of don't want to touch the backs of them up until like this point right here. And then I can get in there and just kind of gently clean up some stuff. This is where I want to use that bendy brush. I definitely want to clean the distal of 12 a little. I don't want any cement in there for sure. You know what I mean? We'll just kind of towel that off a little bit. Okay, and I love the way that color turned out. The try and paste should fairly closely show you what you're going to get, but it's for sure not exact, especially when you add in Bond. There's no doubt about Bond being yellow and having some impact on the final color of everything. So I'm going to take my bendy brush. I'm just going to kind of clean the back sides of the papilla in there. So there's no like big chunks in there. I was telling you guys this before. I also like to just get like right in the incisal or the occlusal grooves of those premolars. And we'll just do these anterior papillas one more time. And then we'll be ready to either floss or fully cure. Whatever you're feeling comfortable with that day. Pick your own adventure. This is the pick your own adventure. Veneer seat. Kira? Who's Kieran? Raise the hands. Who's Kieran? You're Kieran. You're curing. You're curing. Okay. All right. That's how much of a tell I want. That much. This is for sure the most technique sensitive part of this whole process is what I'm about to do. I'm only going to have about that much floss between my fingers. And I want it going through lengthwise. All right, Carrie, open for me. Let me see if I can get that to show up on screen. It almost shows up. For those of you who are like really close, you can see. So it's just really controlled. This is probably the one I'm the most nervous about, just because remember that papilla was like a little bit angry. And then that's given me a little bit of gave me a little bit of pressure right there. So I just kind of abandoned that because I know that's kind of a more gentle papilla anyway.
Say you replace somebody who over prep teeth with just like way thicker restorations, would you tack cure longer than your 1-2?
Probably. I mean, if these are like 3/4 crowns, I might be doing this whole case with dual cure, you know?
He said he wanted a complication to make it better for us.
Cameron's like, no.
Just one.
I like it when the temporaries don't come off quite as easy as they came off. You know what I mean? I wanted you guys to see us take off some more legit temporary veneers, but those look good. I might just touch behind there again with a little 2x2 because sometimes that pulls some stuff through, but we're pretty much good to go. I'm gonna have Karim fully cure these. We got through all but one spot. I probably could have gotten through there, but like it was just, go ahead. it was just a papilla that I know is a little bit tender, so I don't want to mess that too much.
Maybe she does that first.
So she one gears front and back, just 5-10 seconds everywhere.
Yeah, just to make sure there's no chance of blood messing with us. She's gonna kind of like wand carry up. All right, so these are our instruments. I'm gonna go in and I'm gonna clean kind of all the excess that I can find around the edges with just whatever curette is your curette of choice. I don't even know what this is called. Is that like an 1112 or something? Does anybody remember what these are? And then this is like, this guy right here can literally be, this can be your best friend. When you have that piece of cement you just can't get out, that little thing right there. These are like $50 for a box of 4 of those, I think. These are the proxy discs I was telling you guys about.
Of what?
Like 4 of these are like $50. It's so
Camera
crazy.
goes away every time, an accident.
And then if you got the really, really tough one, this is what Michael calls the white guy, which I think is super racist for the record, but he calls it the white guy.
Let me see the white guy.
Right here.
The white guy. We have
We have a white
guy.
I have
There's
this.
the white thing. They're a little short.
Jose and Michael Cubs. Give me the white guy.
I like them better.
Yeah, but the salt part is.
It's like those stairs, because you don't have to- Yeah, it's just in there.
I don't have a lot. But I could.
You're good. Take your time. Get them good.
I made it up.
Space issue is a real problem. Well, it's just not a lot of options. So like when we booked our practices, one spot we could choose, and we had to squeeze into there.
Her whole office is smaller than your room.
Really? It's tiny, huh? But it's close.
Do you have a photography room? I'm like, no.
No, I said room.
It's 2-story though, they cut the room. There's a little short spot up here. Keep your patient.
I could fit 4 ounces in here.
We had to get real creative.
So V-Smile's OG lab is like in Beverly Hills. And they just squish so much into that space. So when we started looking for space over here, they literally couldn't believe what they could get.
That's how it's
For-
going to their offices.
Yeah. Yeah. For like $4,000 a month, you know?
You have a pumping room?
Yes, you should see his staff lounge. It's bigger, it's definitely bigger than my office.
I will have to look up
But he also has like 47.
a dental office near us.
One doctor said, no, too much marble and gold. He loved it.
Ben, how many doctors do you have working in your practice?
I have 3 associates and my wife's orthodontist. But I have a 20-lot practice in an 8,400 square foot building.
8,400.
Yeah.
Your wife works out of the same.
She has like a side as office that she uses.
Okay.
And then we'll use her ops when she's not there.
Oh, okay.
Yeah.
Yeah, it's insane.
So like 4 general dentists working most days,
3 and sometimes 4.
sometimes 4. Okay, let me just kind of show you guys. You guys don't need to see the entire cleanup, but this is what I'm going to do. I want to make sure I don't have there's always like just some stuff hanging out right here. Do you know what I mean? So I'm just going to kind of clean around the facials of these. So we'll clean like these 3 teeth right here for you guys.
So normal dentist.
If I feel like I need to, but honestly, not usually with, it depends on the situation. I'll show you here in just a second.
I'm gonna make it
Okay, so the first thing I'm gonna do is I'm just gonna get rid of like gross cement around the margins wherever with a scaler, right? So there's always some on the lingual, there's always some on the buccal. I'm just gonna get rid of all that. Okay, and then this is the instrument I want you guys all to have in your office. the beauty is it's super, super thin and you can bend it. So I'm just gonna kind of bend that. And then I'm gonna slide it into this area right here, right between 8 and 9. And this is just gonna slice off whatever is hanging out. Dang, that bent on me. Whatever's hanging out between 8 and 9. So it's kind of cleaning up the mesial of 8 right now. And then if I flip it, we're gonna go clean up the mesial of number 9. And so that area right there now is like pretty dang clean. Sometimes you can even like hear it like just like scraping off that cement, you know what I mean? And then you flip it, go the other way. Okay. After I do that, sometimes there's like a little triangle of cement that I knock down. It's just kind of like hanging out in here. So I want to just kind of look. And if there's something for me to pop out, I'll just like look in there and just like pop it out. But I don't really see one right now, so I think we're probably good. And then I'm gonna take my floss and we'll just see like how it wants to come out. I'm gonna clean both edges and then maybe it wants to come out the front or maybe it wants to come out the back, but like that space right there is like clean, you know what I mean? It's done, that space is done. And we'll do this one. This one I can tell there's a little bit of something hanging out in there. So I might do that one a couple times, pull it out towards the lingual. It's probably good. That one's got something hanging out there for sure. I can feel it. I think it popped off though, so I think we're good. So that's your protocol right there. You're gonna go kind of gross clean up with whatever curette you like. And then you're gonna do both sides of each contact with your proxy disc. If you need to get in there with the white guy, get in there with the white guy. Most of the time we don't. And then you're gonna floss and pull out both ways. So floss, pull out, buckle, and then floss, clean both sides, pull out towards the lingual. And once you can do that smoothly on all the contacts, which if you did that exact process, like Karam or Courtney will be done with this in literally like 10 minutes, all 3 of those steps, every single contact. And then what I like to do, I want to show you guys this too before we go. I'm going to take, I'll see if I can hold it up to that screen over there. I'm going to take the really small. So that's a football. It's red. God, it doesn't zoom in very well.
We can see it, the tiny one.
That's the small red.
It's a diamond, right? Fine diamond.
Yeah, it's a small red diamond. I'm going to take that and I'm just going to kind of like, almost like burnish. You guys can see that margin back there. Almost like burnish that margin right there. And I'm going to do that on every single one. And then I don't really care what porcelain polishers you use, but you just want to go from like I usually go just middle. So this is the roughest one. I'm just going to use like the middle one and then the high polish one. And then that's probably it for that. And I'll check the bite at the same time. What else I can tell you? Okay, so cleaning around the margins. Everybody always has a question of like, how do you finish around the margin? And it depends on like what's going on. Like if there's like a chunk there that I feel like I can't get off, you could go in and you could touch it with like, they have really pointy diamonds. I don't remember what the name of this burr is, but it's in our links. They have really, it looks just like a mosquito, but it's a diamond. So you can go in and just like really carefully sand that off. If you feel better about doing it with a carbide, maybe, but carbides tend to like want to grab stuff, so they make me a little bit more nervous. And then if there's a spot you just want to get a little bit more smooth, sometimes these pointed porcelain polishers, the pink is a little bit smoother than the blue. So, you know, if there's like an area right here where it's like, I just don't like the way that feels in my Explorer, you can get up in there and polish it with that, with the blue, and then get up in there and polish it with the pink. And that should be about all you ever have to do if you wanted to like really get after an area. I don't love going in. Some guys will take these like porcelain polishing cups and they'll go up in there and just kind of like gently polish that cement line. You can do that. It's great. And you're going to get a smoother cement line right there. But you just have to be like, I hesitate to tell every dentist this because you just have to be like so soft-handed. You know what I mean? If you're heavy-handed with that at all and you get rid of the glaze on top of those, then you're gonna kind of regret doing that. I would probably feel better about, because that cement line is composite, right? And these enhancing cups are made for polishing composite. But once again, you don't want to just put a ton of like pressure on that. But if you wanted to go and just get like right underneath that gum line with an enhancing cup, that's a great way to kind of get that cement line really smooth as well. So that's our cleanup process. I'm gonna let Karen finish cleaning these up. And then I'm gonna come back in and cement that last crown on, but let's go, I'll go out, join everybody else and debrief.
I need check. I'm still doing it.
Yeah. How you doing? You okay?
Yeah.
Yeah? Awesome. Hi, Gary.
Hey.
Is this mine? This is mine, right?
That's mine, but if you
Oh.
want to finish it,
I thought that was mine. Where'd mine go?
I think you might have put yours in.
Where'd I put it?
I did like 5 interviews, but everyone was so tuned in, I didn't want to like
Oh,
pull
okay.
them. I just pulled them when people were going to the bathroom.
You can do it after too.
Yeah.
People kind of hang out. I think that's mine right here.
It was funny. I got like all guys doing it. I haven't got a girl yet.
Lower your case on that thing and see what it looks like. Not bad. Nice job. James, nice job, dude. Put your arms up. Over here?
I don't think so. Am I sweaty?
No, that's legit.
No, I'm good. Okay.
Yeah. So smooth. Did he make it look easy? He does make it look easy. So I want you, next time you deliver a case, just go, I'm James C, I'm James C, because it's going to be a totally.
Don't do that. That just means you're going to make every single mistake. I've screwed everything up.
What questions do you have about that? I want to get into a couple things here. Nobody has any questions? You did an excellent job then.
It was good to watch how patient you were with the tissue.
Mm.
Cat, like I would have given up.
Chris, you can't give up. Chris, next time you deliver a case, you're calling both me and James. We're gonna come.
Chris, what would you have done differently? Would you have done anything differently with the tissue? Because there's not one method. You could have soldiered it and just packed one cord all the way around right from the beginning, and maybe even have been faster. You know what I mean? If you want to do that, what would you do though? If this is in your practice, what would you do?
I am a huge believer in the waiting for 5 minutes. Like you taught me that as well. That's a huge game changer. Is to be patient. So hard, right? I mean, just I don't have anything to do. I'm gonna use a super awesome one.
Yeah, you used it a lot today.
I did use a lot today. There's a lot of little spots, like just kind of making me nervous.
Well, you didn't know that they're there until they quiet. You know? Like,
Yeah.
You can't see them until.
Yeah. What other kind of takeaways do you guys have watching that in real? Because it's different watching me present it in slides and then watching me actually do it. Did you notice we forgot to pumice? We forgot to pumice. Yeah.
That's right, Dr. Evans is pumice.
Yeah, it's true.
That was warm white, right?
But you microwave, so
That was the soft white, Panavia's soft
I
white.
feel like you pretty much always end up doing soft white or not a lot of times.
I like to. I actually feel like I used to use clear a lot more. The problem with when you use clear, I believe, I don't have any science to back this up, but I believe that the veneers end up a little bit warmer than what the patient approved because you add bond in there. And that bond is so flippin' yellow. And if you have thin veneers, I think a lot of times they end up a little bit warmer than the patient like actually got to look at. So
I think that cancels it out. That soft white.
I think that it lightens them a little bit beyond what they initially saw, but I would rather it lighten them a little bit than warm them a little bit, I guess. So I'm using light a lot. I also feel like the color of the veneers overall are more consistent when I use just like a little bit of lighter cement than if I use something clear. I feel like my consistency is better. Do you think that?
Yeah, I agree. Anybody else? Anybody have any questions, takeaways?
I just felt like everyone has said with how long you were, but like what Chris is saying, because you were able to control it, so like I was like, come on, you know, like, I feel like when I'm in this process, I'm just hurrying because I don't want the bleeding to start,
Yeah.
but like because you took your time and had it all controlled, you were like not in any rush, like you were just letting the bomb sit there and then you put it on, so that was impressive.
Tissue controls like everything, huh, Michael?
Everything.
So if you did cord like the whole way around,
Dr. Soto will.
when do you take that out? Like at what stage?
Is your assistant doing that there?
Yeah.
Just after everything's like fully cured and you've done most of the cleaning, then you just kind of pull it out.
Okay, and it'll probably knock some of this stuff out.
Yeah.
Yeah, we'll bring it.
And if you were to do it that way, you put a little viscous pad, I think you guys were saying earlier, and then pack the cord and then do a gentle rinse.
Mm-hmm.
Cool. Should we get into patient psychology? A little bit around.
I think we should. Patient psychology and
We
then
can do some cases.
a couple cases.
Yeah.
It's only 3, dude.
You're good on-
We're doing good on time.
We're way good on time.
We should have seated 2 cases.
We should. Yes.
Let's do it.
Well, next time.
Examination last week.
Call him on the weekends and then. Chris has become a whipping boy. Cool.
Yeah, let's do psychology.
Okay, this is yours.
Oh, cool.
And then.
Carrie, how you doing? Are you okay? Yeah. You feeling good? Yeah. All right. Anything hurting you? Yeah. Okay. Everything looks so smooth. Yeah. Yeah. And what I think I'll see an option.
So I only have universal, warm, neutral, and light.
Neutral and clear, right? My brain will use those.
What about light and soft white?
I want to use Canadian every time I can. I would say at this point, the only time I want to use very pink is if I'm using a warm or the light blue. I probably won't use red and light anymore. Okay. Just because like it's the same as soft light.
Why didn't we use soft white as a time?
What's that?
Why didn't we use the soft white as a time? Oh, you said you wanted to use the light.
Yeah, I just said light.
Oh, okay. And so that's why when I do this, I see we're doing the light and
Yeah,
this.
these two are pretty much the same.
Oh, okay.
Very, very similar.
And then you have like the triangle light. Like I will clean it.
You look this good, what's good? How you think about